Okay, more now on our top story. The UN Security Council's response to alleged chemical attacks in Syria. Dr. Ahmad Tarakji is the president of the Syrian American Medical Society. He's joining us now via Skype from Fresno in California. Thank you very much indeed for your time, sir. I understand that you're in touch with teams on the ground. What are you hearing from them about the attacks?
Thank you for hosting us. The team on the ground is devastated at this time. As we know, the recent chemical attack actually coincided with other attacks that had been targeting medical facilities throughout Idlib and northwestern Syria. The attack right now on our count as civil society counts the number 196 since the conflict erupted in Syria over the last few years. And still at this time, there's no mechanism to attribute, investigate, or assign accountability of those attacks.
We've seen some terrible pictures coming out as a result of these attacks and others. Can you describe to our audience what it is like to be caught in one of these attacks?
Just to describe what is going on right now in that area, in Sarakib and Idlib area, there has been many attacks on medical facilities over the last few weeks. We know that the medical system at this time in Idlib and the suburban Hama is completely paralyzed. With those attacks destroying the ability of the first responders and medics to respond to these attacks, now those chemical attacks are terrifying the civilians. We know that chlorine might cause symptoms of irritation, shortness of breath, agitation, and where people are not able to grasp their breath. And they're struggling with that. Those symptoms can be treated, especially if the concentration that people were exposed to are low. But still, they're terrified. There are no medical facilities that are functional close to them. The medical facilities are already overwhelmed with the traumas and injuries and the regular health needs of the civilians in those areas. Now, those attacks come in, people come in, they might not even be able to find oxygen or nebulizers to improve their breathing. And that is what's going on in that area, where people feel that those chemical weapons are being used to displace people out of their towns and scare them to the point where they would leave and maybe seek refuge somewhere out of Syria.
I know that your organisation, like some others, have been attempting to build stronger facilities in order to try to withstand some of the attacks that have been going on. But we saw recently there was an attack on a hospital in a cave which essentially destroyed it. Now, luckily, there were no injuries in that. But what hope do you have of being able to continue to provide medical facilities under these circumstances?
Over the last few years, we hope that moving some of those hospitals to safe locations underground or in caves will allow us to provide services to the people in those areas. And unfortunately, we've proven wrong. We've seen that the variety of missiles are being able to destroy any infrastructure that we can build to serve the people. At this time, we are looking towards accountability, or the least of it is to freeze the conflict, to de-escalate it to the point where, for example, grounding the Air Force, that's the one that's been using chlorine and chemical weapons against civilians. If that's achieved, if de-escalation is achieved, at least civilians will feel that less injuries can be achieved by using chemical weapons and other weapons that have been used in Syria, like cluster bombs or so on. Short of that, we are committed to serve the people in need. We will continue what we can do, but that's all going to be burned out and destroyed as chemical weapons and other weapons being used inside Syria.
You've talked to us about the impact of these attacks on the people in the area, the civilians in the area, but there must surely be an impact, if nothing else, psychologically on the medical teams that are trying to help these people. Tell us a little bit about what's motivating those teams to stay there when the danger is so great.
Over the last few years, we've lost hundreds of medical workers inside Syria. And over the years, we all realized that we are deliberately targeted as medical workers. We felt, as we've seen in Aleppo and other places, that the medical workers are the backbone of the civil society at this time. And in every single town, destroying the medical facilities led to the collapse of the town. So that's why the physicians and nurses and ambulance drivers and everybody is committed to support the people in that area. We have seen how people have lost their lives as medics losing their lives as they're trying to rescue others, including exposure to chemical weapons, as we've seen in Khan Shaykhun, for example. But with that, still, people are committed. The medics are committed to their own people, to their own communities, and they will continue to serve them. And we, as an organization, are committed to serve the people in need.
Dr. Ahmad Tarakji, thank you very much indeed for joining Al Jazeera today.
Thank you for the opportunity.